Bismillah Rahman Rahim.
I'm sorry.
Good evening, everyone. So, today with us, a famous homeopath from USA, Crystal. So, can you tell
Hello.
me about your name
My name is Crystal Arbogast, and I'm over in the East Coast of the United States.
and where you from?
I am actually a military brat, so I was born in Maryland, and I currently live in West Virginia.
Okay. So, what is your qualification?
Well, I've been practicing or using homeopathy, I want to say over 11 years now. Family, friends, anytime that anything happens in my home or around me, I'm always using homeopathy. And then I went to Joette Calabrese's Academy for Practical
Okay.
Homeopathy, and I graduated last year. And then I'm doing a bunch of different courses with CHE out of England. And then I'm also working on a clinical homeopathy program.
Okay. So wonderful. Okay. Can you tell us how you start journey with homeopathy?
I actually started from I was in church and my daughter had slammed her finger in a door. And one of my friends had actually said, well, I have something that might make her feel better because I didn't have anything. I didn't have Tylenol. I didn't have any Motrin or anything like that. And I said, sure, what
Okay.
is it? And she said, arnica. And she gave my daughter arnica. And within, I want to say less than 30 seconds, she was smiling and running around. And I looked at my friend and I said, what is that? Where did you get it? And why did it work so fast? Because not even Tylenol would work as fast as arnica did. And that's where I started my delve into homeopathy.
Wow, wonderful. That is the beauty of homeopathy.
It is.
So, can you tell us what is homeopathy?
Well, it's a lot of different things. But I guess the most basic response is homeopathy is a form of medicine that takes um, diluted plants, minerals, and then succusses them, and give it helps heal the body and promote healing within the body when the body is suffering from an illness or a
Okay.
disease.
Okay, wonderful. So, do you know about historical?
The history of homeopathy. Yes.
Yes.
I know. Um, I know Samuel Hahnemann started it in the 1800s. He was a German physician who. There's a lot of stories, and I mean it's a very long history, but the kind of shortened version is he was a regular physician, and he didn't really like what they were using, to treat people, bloodletting, and they were using leeches, and the the form of medicine they were using he saw was being more harmful than actually good. And I remember
Good.
reading about how he had read a book written by William Cohen, I believe, and he was talking about the use of cinchona or Peruvian bark and in order to cure malaria. And Samuel Hahnemann saw this and was like, something's going on, and decided to experiment on himself. And
Okay.
he used cinchona. That was the first experiment with homeopathy. He used it and tried to cause symptoms of the malaria in himself by using the cinchona bark. And he saw that it did produce the same symptoms. And that's where he came up with the idea of like cures like, because he was taking the Peruvian bark, it caused the same symptoms as the malaria, which in turn, when you gave Peruvian bark or cinchona to people with malaria, it cured them of the malaria.
Okay,
But I know
good.
that
So, do you know
he
what what are the physical, mental, and emotional aspects of homeopathy?
So the physical aspects are like if you get a cough, um, if you have a headache, if you have a upset stomach or sleeplessness. And then the physical and emotional aspects, I kind of look at them somewhat as together. How does your body respond physically, emotionally, and mentally to things that are happening to you? So, depression, how does your body respond to that? What symptoms does your body create? When you're suffering from being sad, having, you know, different moods that, you're happy one minute and sad one minute, how is your body responding? And what are the symptoms that your body is showing? And those would be, when I look at the physical and the mental, those are just some of the aspects of what homeopathy looks at.
Okay, so what are the three level of homeopathy therapy?
First aid, acute, and then you could call them chronic or the constitutional, is what the three levels.
Okay, okay. Can you explain about first aid?
Well, first aid is like your child runs outside, trips, and gets a scrape on their knee, or you have a burn from um, cooking something on the stovetop, or you get a sprain. You're running through, you're jogging or something, and you trip and you get a sprain on your ankle. Acute homeopathy is like a flu or a cold or a cough, something that's short term, something that's not going to last for a long period of time, something that might come on rather quickly, or it could come on slowly, but usually it's a short term illness. And then your constitutional or your chronic is going to be a disease or an illness that you have been dealing with for a long period of time. It's something that the body has, for years or months at a time, that it could be asthma, it could be eczema, it could be ear infections that are reoccurring constantly. It could be someone who even gets a cold every 3 months. That's something that's a chronic, and that would be more considered conventional, or not, sorry, not conventional, but constitution or chronic.
Okay, that is wonderful. So, do you know what is the relationship between symptoms and homeopathy?
So the relationship between symptoms and homeopathy is that we take the symptoms that a person is experiencing and we use those symptoms to try and find the correct remedy or remedies in order to promote the healing of the body so that those symptoms essentially disappear. Or I don't like to say cure, but they eventually, they get rid of um, or alleviate the symptoms that that person is experiencing.
Okay, tell me, can small doses be effective?
Absolutely. And that's 100% homeopathy. Um, and I guess they're not really small doses when you think of it, but when you look at for example, if you take the gross substance, it's small doses. But I think in homeopathy, we look at like a 200C or a 1M. That's not considered a small dose in homeopathy, but I guess in the conventional allopathic world, they would look at that as a small dose. But I believe that they're effective because they produce. So Hahnemann learned that he could take a highly toxic gross substance, he could dilute it and he could succuss it, and that would provide the healing that the person needed that was experiencing whatever those symptoms are. And I guess that's where they would come up with the small doses, because you take the gross substance and you dilute it and you succuss it down to a very small amount. So I guess that could be considered small doses.
Tell me, how can the correct homeopathic remedy be found?
Well, as a homeopath, our job is to kind of delve into what is going on in a client's life, mentally, physically, and emotionally. How is their body dealing with stress? Are they dealing with stress? Do they have any type of symptoms that they're dealing with? And we take all of that, the whole person, the totality of the person, all of those symptoms, and we go and we try to find a remedy that would match what that person is dealing with in all three levels: the physical, the emotional, and the mental. And that's how we find the correct remedy.
So, what is the homeopathy's approach?
Well, homeopathy is all about the whole person. It is the most holistic medicine out there, I believe. And it takes what the person is experiencing and it takes each person individually and it finds them the right remedy that's customized to that person with the whole intention of removing what is causing their illness or their symptoms or their problems at that time.
Explain the homeopath's role as a detective.
Well, it's detective because not not many people like to talk about anything beyond, let's say they have a stomach ache and they want to talk about what they're feeling in their stomach, but not many people want to go beyond that. How are you dealing with it emotionally? How are you dealing with it mentally? What other things could it be causing? Do you get headaches because you're thinking about the pain that you're dealing with in your stomach? And our job as a homeopath is to kind of dig in and be the detective to find out what's really going on. How is the body actually responding to what is happening? What is it beyond those symptoms, right? Just the initial symptoms of a bellyache. What else is happening? So we have to be the detective. What happened? Let's say they've been dealing with it for 5 months. What happened right before they got the bellyache? Was there something, a traumatic event, an illness, a surgery, something that happened in their life that might have then caused this bellyache and they just never associated it with that bellyache? So our job is to be the detective, ask the questions and find out what's actually going on.
Okay, tell me about homeopathic treatment.
So when I have a client that comes to me, the first thing I do is, you have to get to know them. You have to make the person feel comfortable talking to you about what can be very sensitive issues. And so the homeopathic treatment is not just finding the right remedy. I believe the homeopathic treatment is also getting to know the person and making that person feel comfortable and trusting you and the process that you're going through to try and help heal them. And so the final treatment is just the remedy, but I think the whole treatment is treating the whole person, letting them know that you are there, that you hear them, that you're listening to them, and that you want to help them, and that it's a process that both of you are going through in order to kind of cure them and to heal them of the illnesses or diseases that they're suffering.
Wow, great. So, tell me, homeopathy is a proved science
I believe it is. I know that there are many in the world that believe
because so
there's
many people asking this question. Homeopathic is a proved science.
it is. I think there have been a lot, and I mean hundreds of studies out there. And what's unfortunate is that the conventional or the allopathic world and the people, the naysayers, the skeptics, the people that say that homeopathy is just a placebo, they take one or two studies and they use that as the crux of the reason why homeopathy doesn't work. But I believe that homeopathy is 100% proved science. I believe that if you look at even today's treatment of allergy shots, what do allergy shots do? They take a substance in small amounts, they inject it into the body to try and create a response. Like versus like. If you're allergic to a dog, or if you're allergic to apples, or if you're allergic to tomatoes or whatever, the allergist is taking the the substance, the dog hair or the tomato, or they're taking that substance and they're injecting it into your body to cause the body to receive an antibody response to help you so that you're no longer allergic to those items, right? That's what homeopathy is, but homeopathy was way before allergy shots started. So they're already proving it almost with their use of conventional medicine. They're already proving what homeopathy proved 100 years ago, in my opinion.
So explain, are homeopath is qualified doctors?
So in the United States, there are homeopaths that are doctors. I am not a qualified doctor in the sense I did not go to medical school. Um, but there are doctors that are in the United States that have gone to medical school and then have gone on to learn homeopathy. I don't call myself a doctor because I don't have the medical qualifications to be a doctor. But homeopaths, in every school that you go to, you're going to be required to go through anatomy and physiology. You need to know how the body reacts to things. You need to know about the skeletal system, the muscular skeletal system. You need to know about the cardiovascular system, the pulmonary system. You have to know how the body works. Even though homeopathy is based on symptoms, you still have to know how the body works. You have to know about the parts of the body, and you have to know how everything works together. So I know in other countries, I know in India, and I believe in Pakistan, you guys have gone to medical school and you have the medical background. But in the United States, it's not a requirement. And in Europe, I don't believe it's a requirement.
Good. So is it true that homeopathic medicine are only placebos, sugar pills? Because
No,
most of the people, so
I
these
have
are
heard
only placebos, sugar pills.
I have heard that so many times. I've read it in a lot of different places. And I guess my argument would be a placebo does not work on a plant or a baby or an animal, because a plant, a baby, and an animal have no idea what they're getting. And I have seen with my own eyes, I have friends that have experienced where the placebo sugar pill has worked with their plants. It's worked with their dogs, with their horses, with their chickens, and with their babies, 2 month old, 1 month old, 6 months old. They can't talk. If it was a placebo, they wouldn't have worked with those patients. But also with the way that nanotechnology is nowadays, they're finding it's not just the sugar pill. I know that there was an argument that it's a sugar pill because if you take, for example, a arnica 30C, when scientists go to test it, they no longer find any of the gross substance of arnica in that pill, which is true. But with nanotechnology now, they're finding that there are nanoparticles that are still in those remedies past Avogadro's number. So past the 12C, past 30C, past 200C, past 1M. So I think as we become more advanced, I think homeopathy is going to prove that it's not just the sugar pill, that there's a lot more to it. And we're going to be hopefully deemed true in what we've been saying for 100 plus years.
Good. So does the homeopath give the same white pills to everyone, so every patient, every illness.
It depends. So in classical homeopathy, like I was saying before, it's a whole person approach. It takes what that person is experiencing at that time, the symptoms that person is experiencing. And everybody may react differently to a certain illness. My cough might be different than your cough. I might have a barky cough. You might have more of a wet cough. It might be more in your chest, and mine might be only, from the throat, might feel like I have something caught in it. So my symptoms might be different, yet we both might just have a cold. So in that sense, I might get a different remedy than you because our symptoms are different. But there is, with the Banerjee protocols, they do take one illness and you would take the same pills for that illness, depending on whatever the diagnosis was. So it depends on whether you're looking at classical homeopathy or if you're looking at the Banerjee protocols.
Okay. So does homeopathy take a long time to act?
That also depends. With an acute, no. Usually you will see, I always tell my clients, my friends, and my family, I say, if you've taken a remedy 4 times in an acute situation like a cold or a flu and you're not seeing improvement, we need to move on to another remedy. We need to look at another remedy because in an acute, you should see almost immediate results. But for a chronic, when you're dealing with eczema or you're dealing with asthma or you're dealing with gut issues, it took a long time for your body to produce those symptoms, for that disease to produce in your body. And it's going to take some time for homeopathy to work that out. Not forever, but it can take more time because it took some time for you to get that way.
Why homeopath take a detailed history?
Well, I believe that, so we need to know what is going on in a person's life, but not only what is going on at that moment in time, but maybe what happened prior to the onset of whatever they're dealing with. So we need to have a detailed history. We don't want to just know I walked home and I started experiencing a cough. That's not going to give us a lot to go on. We need to know, what were you doing? Were you outside? Was it raining? Was it cold? Was it hot? Um, were you walking home because you got into a car accident and now you're walking home? What are the reasons? What happened to cause you to walk home and then now you're experiencing this illness, this sickness? So we need to know the details. We need to get into what's going on so that we can provide a better remedy, a more definite remedy that's more individualized to what you are experiencing. And the more detail we have, the better we're going to be at finding the right remedy to alleviate those symptoms.
So this is important question I ask you. Tell me, do homeopathic medicine have steroids?
No.
Because so many people asking about this question. Maybe a homeopathic have a steroids or doctor using steroids. So what do you say about this?
No. No. uh, Homeopathics are not like your conventional medicines. They are not synthetic drugs. They do not use steroids. Homeopathic could be made from a steroid drug, but homeopathics do not use steroids.
So homeopath do not tell the name of the medicine. What is the reason?
I personally tell my clients what homeopathic remedy I'm giving them, but I can understand why there are homeopaths that do not. And I think it's more because what normally might happen is that a person is told, I'm going to give you gelsinium, for example. And they're going to take that gelsinium and they're going to go home and maybe they look it up on Google or they look it up on the internet and they see that it might cause other problems. And what they don't realize is that the herbal version is very different from the homeopathic version. Or they'll tell their doctor, I'm taking arnica. And the doctor's like, no, that's very bad for you. You don't want to take arnica. Because the doctor is of the premise that you're taking the gross substance, the herb form of arnica, and not the homeopathic form of arnica. Those are very, very different medicine. Those are not the same thing. And I think it's because people get confused. They think that homeopathy is herbalism when it's not, because we do use herbs, but not in the same way, if that makes any sense. So I can understand that a homeopath would not necessarily want to tell them what remedy they're taking because they might go and try to research it and get all of the wrong information and then decide, I'm not going to take it, and then complain that homeopathy did not work for them because they didn't take the remedy because they thought it was poisonous or dangerous or whatever it may be. And then they throw homeopathy out and they don't come back to it.
Okay, good, wonderful. So tell me, homeopathic remedies have side effects?
No, there are no side effects to homeopathic remedies. Um, Not like in your conventional drugs. And like I said, that's another thing. You can get aggravations for using homeopathic remedies, but that's not the same thing as a side effect. An aggravation is not going to cause you to be sicker than the illness that you're experiencing, if that makes any sense. But it could push people off from, I don't want to take that because maybe I take a remedy and my stomach ache hurts even more. That's not you getting sicker, if that makes any sense. It's the wrong remedy choice, essentially. Or it could be the right remedy, but sometimes you experience it might get worse before it gets better. And it's something that your body has to go through in order to get over that hump, to get over that illness that it needs to. But like your conventional medicines, no, you're not going to have death is not a side effect. A more severe illness is not a side effect of homeopathy. You're not going to get tuberculosis from taking a remedy that's used to treat tuberculosis. You're not going to get malaria from cinchona bark. You might get the symptoms if you're healthy, but if you're sick, you're not going to get malaria. I hope that makes some sense.
Very good. So can you share with us your successful case, which you are not forget during
I
your practice?
I've had I believe that I've had many successes, um, mostly in family and friends. I did have a patient that came in and was talking to me about pain that he was suffering after a total hip replacement, and he was having a hard time walking, and he wasn't able to do the things that he used to be able to do, you know, walking his dog, taking his morning walks. And he was in his late 60s, and he had gone back to the doctor, and the doctor essentially said, you have scar tissue from the hip replacement, and the only way to get rid of scar tissue is to have surgery, and they would have to go in and essentially scrape it out and get rid of that scar tissue. And he really didn't want to go back into surgery. And so I told him that there is a homeopathic option, and I prescribed him a homeopathic for scar tissue, thiocinaminum, and within, I want to say, a month and a half to 2 months, he told me that the pain was gone, that he was no longer feeling any pain. He was able to get up and do his walks. He was able to get up and do all of the things that he wasn't able to do without the pain. And it's been 11 plus months and no return of the pain. And so I consider that a good success. He didn't have to go in for surgery and he got rid of the pain. And now he looks at homeopathy as an option. He still likes to go to the doctor, but he looks at homeopathy as another option that he could try and that works for him.
Wow, great and wonderful.
And I've had many other um, successes as far as a lot of acute situations. So I have 5 children, and they like to fall, get bruises, get cuts and scrapes. It's constant in my house. And that's why I have every single potency of arnica and hypericum that you can imagine in our house. But I remember one time, my 4-year-old, they were putting up the table in our dining room, and the she got her fingers, 2 of her fingers, caught in the the pieces of the wood that were coming up together, and screaming and yelling, pulled her fingers out, and they looked almost flat. And as a mom, first thing you do is worry, oh my goodness, what's going on? We need to go to the hospital, or we need to go to the doctor. We need to get x-rays. We need to make sure you didn't break anything. But as a homeopath, step back, take a breather, and I gave her hypericum and arnica. And within about a minute or two, it took a little bit longer, but within about a minute or two of giving the arnica and the hypericum, no more crying. Within about 5 minutes, the fingers puffed back up to regular. I felt around, I made sure that she could still move them, there wasn't anything broken, and she was running around and actually telling me to leave her alone. So I looked at that as a huge success, because kids deal with pain, and it's very upsetting for them, and it can cause a lot of stress for them. And the quicker you can get rid of that pain and get them back to playing, the better it is for them mentally and emotionally and physically. And so seeing her within a couple of minutes back up and running and actually telling me, Mom, I'm fine, leave me alone, was a huge success for me. And I've had I've had one where my son fell, and he hit the corner of a cabinet, and he had this mark going down his head, and he had this huge hematoma on his forehead. And arnica, absolutely 100% arnica. I gave that to him, and within a minute, he was stopped crying. He was still kind of moping a little bit, so I gave him another dose of arnica, and he was out running around. Within 30 minutes, the hematoma was gone. There was no more hematoma there. He just had a line, of
Wow,
course, because he hit the corner.
amazing,
But
amazing.
yes, absolutely. And to me, that's the beauty and the amazing thing about homeopathy, is that I was able to give my children something that almost immediately, within minutes, they were back to, I'm normal again. I'm not in pain. I want to play and I want to do this. And that's the best thing you can ask for when it comes to kids.
Wow, it's a wonderful and nice talk with you.
You too.
And thank you. Yeah, thank you very much. You giving us time and record your interview. And tomorrow, I hope I put this interview on my YouTube channel.
Okay.
Okay, so thank you very much and God bless you.
Thank you. You too.
Okay, okay. Have a good day.
You do the same. Thank you.
Okay, bye bye.
Bye bye.